Thank you, everybody. Those who are watching this from YouTube, CSIS YouTube channel, and also from our Zoom webinar. This is our third webinar in the series of we are trying to learn lessons from other countries that have been dealing with this COVID-19 challenges in the past few months. The first one we had with Singapore, and then the second one with South Korea. And this is the third webinar in order for us in Indonesia to learn what has been done correctly or not so incorrectly from other countries, so we can probably learn some lessons so we are not making the same mistakes. Now, I'd like to mention to our audience that we have this is a collaboration between CSIS and our longtime partner, good friend, Shanghai Institute for International Studies. And we have Professor Chen Dongxiao. He's the president of SIIS. And thank you very much, Professor Chen, for agreeing to do this. And then also, I think we are excited to have Dr. Pan Hao, who is the director at the Department of Communicable Disease Control and Prevention, Shanghai Municipal Center for Disease Control and Prevention. Thank you, Dr. Pan Hao. Now we have about 90 minutes. So I'd like to start with, I think, Professor Chen to give his remarks, maybe 10 to 15 minutes. The floor is yours, Professor Chen.
Okay. Thank you, Philip. Good afternoon, ladies and gentlemen. It is my great honor to be here with our longtime partner, CSIS Jakarta, for this video conference webinar. First of all, on behalf of my colleagues of SIIS, as well as myself, I would like to convey my sincere greetings and appreciations for all those in Indonesia who are in a battle against COVID-19 virus. Please also accept my condolences and sympathies to those who have passed away and those who have been suffering from the loss of beloved. I believe all Chinese hearts are with you together. My introductory remarks will be quite brief, as I understand that the coronavirus pandemic exposed a world health crisis and a stress test for global health cooperation, exposing a glaring governance deficit in the global health landscape. Threatened by the disease that is more contagious than SARS or MERS, will the world unify in a solidarity to stop it in a concerted efforts? Or will nations be so overwhelmed by the growing fears as to resort to the so-called beggar the neighbor policy, weakening the foundation of a global public health cooperation? Is the fast spreading virus a wake-up call for the international community to act swiftly and in a concert to build a safer globalized world? Or does it portend a further deglobalization, as some people call it, in a world already beset by a virulent nationalism? There are no easy answers to those questions. Things may take either direction. As the coronavirus continues its march across the world, it is a high time for the international community, as well as our two countries and the peoples of our two countries, to build up a more effective and resilient public health cooperation, both bilaterally and multilaterally or globally. 3 points, in my view, deserve special mention. First, international solidarity and cooperation are indispensable for fighting against pandemic. Human experiences with epidemics, from SARS to H1N1 and from Ebola to the current COVID-19, have proven that internationally coordinated responses are essential in any global public health emergency. Take the COVID-19 outbreak as an example. As the first line of defense against this newly identified deadly virus, China has made great effort and paid a higher cost to open a precious window of opportunity for others to take precautions. At the same time, closer international cooperation in such form as joint research programs medical material assistance, engagement with leading research institutes, and WHO's indispensable role in countering all virus-induced stigmatization and politicization helps the international community set up science-based and well-coordinated response mechanisms. During its tough days of battle against epidemic, China has got a huge assistance from around the world, including from Indonesia. In return, China has also reached out its helping hands to many other countries hard hit by the COVID-19 virus, including Indonesia. This is the manifestation of a humanitarianism and a growing sense of a world community of shared future. Given the many flaws and vulnerability in today's global public health governance system, had China not act decisively and coordinated with the rest of the world in the early stage of the epidemic, we may now be in a far more serious health crisis around the world. My second point is China's response measures and experiences are valuable and relevant for those in battling against COVID-19 pandemic. Countries vary in their national condition and capability, and each epidemic outbreak has its own characteristics. As there's no silver bullet to address all epidemics, control measures should be customized and contextualized, but timely transmission route interruption, earlier detection, and effective treatment are essential in any prevention and control measures. As the main and earlier battlefront of the global antivirus war, China has made the great efforts, take the strictest measures, gained the most first-hand experiences, and achieved the most remarkable results. Many Chinese practices have been commended by the WHO. For example, the whole of government, whole of society mobilization system, unprecedented social, or maybe more precisely called physical distancing measures, timely and adequate information and knowledge sharing with WHO, and deep involvement in the international medical research cooperation. So China's holistic, science-based, targeted, and highly contextual approach that has been guiding all its response measures in the past few months, I believe, is the most valuable lessons for each virus-impacted countries. My third point and last point is more hard work needed to strengthen the global public health governance system. The unfolding coronavirus crisis has exposed many flaws and vulnerabilities in global public health emergency preparedness. Countries differ starkly from each other in terms of political and value system, social norms, cultural and tradition, and health emergency preparedness and capacity. Given the uneven distribution of global health risks and the desperate levels of national emergency preparedness, as well as geopolitical factors, such as the regional and global security contingency and crisis, a health emergency in one country may trigger different reaction and responses across the world, making consensus building difficult and international cooperation even more so. To address these challenges, we must first update our outmoded health security concept to overcome the curious panic neglect cycle. Second, man the flawed health emergency response mechanism and build up core monitoring and response capability in developing countries so that international health regulation can be upheld amid health crisis. Third, strengthen leadership and bridge resources shortfalls in global health cooperation and make earnest efforts to counter politicization and stigmatization of health crisis. And fourth, increase experience and knowledge sharing on public health emergency response so that the world does not have to start from scratch in every crisis. Humanity's past encounters with the virus and the epidemic have proven and will prove again and again that empathy, solidarity, and coordination are the only rational response to the massive outbreaks of infectious disease and will lead us what will lead us to a safer globalized world as a community with a shared future. So I will stop here. I will leave more time and for our Dr. Pan, Professor Pan, to elaborate his professional expertise on how China can share with your side about our control prevention of this disease. Thank you very much.
Thank you, Professor Chen. And I think the three calls that you made are timely. That is for more international cooperation, more solidarity, humanitarianism. And lastly, I think you are right to point out that this is a time to rethink about the global governance of health, public health and health security. And then I hope that after the dust of COVID-19 settled, countries across the globe would start to think about and then how to deepen, surveillance system cooperation among countries. Now, before I hand over to Dr. Pan Hao, I'd like to remind people who are attending this, you can actually post questions through chat. So you type in your questions, and then I can see your question, and later on I can pick them up and ask and raise it to our distinguished two speakers. Now we're going to have Dr. Pan Hao of the Department of Communicable Disease Control and Prevention of Shanghai Municipal Center for Disease Control and Prevention. Dr. Pan, the floor is yours.
Okay. Good afternoon, everyone. I'm Hao Pan from Shanghai Municipal Center for Disease Control and Prevention. And as you know, COVID-19 has now been sweeping through the whole world. So today, it's my honor to be here to share our experience in fighting this virus. I hope today's talk could be helpful. First, let's take a look at my city, Shanghai. Okay, this is the map of China mainland, and Shanghai is here. Shanghai is the largest economic, financial, trade, and shipping center in China. And there are 16 districts in Shanghai, more than 24 million permanent residents, including 10 million floating population in the city. And in Shanghai, the sex ratio is about 1:1 versus 1 with a good balance, while the elder people, which refers to more than 60 years old, and account for the 32%. So population aging is a problem in the city. As you know, the elder people has a high risk to be infected by coronavirus. In Shanghai, we have relatively advanced medical technology and high quality health resources here. Therefore, the average life expectancy reaches about 84 years. The infant, the maternal mortality rates are both quite low. And here, this slide shows us the structure of Shanghai CDC system and our partner. With the leadership of Shanghai Municipal Health Commission, a three-level network, including municipal level, district level, and the township level, is applied in the daily disease surveillance and the prevent work. In addition, with the cooperation of universities, research institutions, professional committees, related clinical organizations, and NGOs, we also conduct scientific research to make evidence-based decisions and guide our work accordingly. Okay, in the second part of my presentation, I'd like to talk about our response to COVID-19. Okay, we have 339 local cases and 301 imported cases from abroad as of April 22. And before March, we were facing the pressure from the other part of our country, including Wuhan, including the Hubei province. And while now, and almost all the confirmed cases were from abroad, such as Russia, such as America, and the Western European countries. And this slide shows us the time distribution of all the confirmed cases, including the local cases and the imported cases, according to the earliest onset. You can find, the first wave of the local outbreak, the left side, the local outside reaches its peak on January 27, and then gradually decline. And after the first, the imported case falling year on March 3, and was identified. There came the second wave of the overseas imported outbreak. However, the distribution of the second wave was quite even without extreme peak. Oh, sorry.我点错。We also present the time distribution for imported cases according to the entry date and the date of diagnosis. The blue bar and the yellow bar and the blue bar. We can find on April 10, 71 COVID-19 patients arrived in Shanghai via SU or SU10H, making the peak very high. On the next day, April 11, there are 52 cases, including 51 cases on the same flight were confirmed. So then I will share the actions we have taken from the 11 aspects. The first time response. On the last day of last year, the same day, media reported the pneumonia of the unknown origin in Wuhan. Shanghai CDC formulated the report on the public opinion monitoring of pneumonia and the private suggestion on the risk of the response to pneumonia of unknown origin in Shanghai. So this is a very important step. And the second, careful field epidemiological investigation. We have a team of two levels, a municipal level and a district level, and the 737 people in total. The criteria of epidemiological exposure history investigation were leaving no gap in time scale. As for close contact determination, we require not to miss out any contact. Besides, we also have the support of analyzing big data to identify infection origin and the close contact. The third, we put out 4 earlier principles in case management, including early detection, early report, early isolation, and early treatment. Fourth, strengthen close contact management. In January, close contacts could stay at home or in congregation to undergo quarantine and medical observation. While after February, congregation is the only choice. So far, we have quarantined the 15,000 close contacts total and trust the close contact from 200 flights. We also telephone traced 60,000 individuals. The fifth identify the epidemic analysis and assessment. We make a risk assessment based on both the whole city and the Yangtze Delta area. Epidemic analysis are made on local cases and imported cases. A total of the 83 daily analysis have already been issued. And the sixth, the treat patient together scientifically. We bring patients and experts together, pool resources and treat patients together to increase recovery rate and decrease the death rate, prevent the hospital infection. For vital cases, and we conducted the early warning intervention, monitor inflammation indicators and the immunological functions. The lung image testing was also carried out. Most of them were treated with traditional Chinese medicine, and for critical cases, and we set up treatment groups. One hospital assembled one groups, and customized treatment plan was made for each patient. And the 27 lab testing. And for nucleic acid testing, we applied real-time RT-PCR. We detected IgG, IgM for serum testing. Virus isolation was also conducted in BSL lab. In addition, we did some genome sequencing. And the eighth, and the disinfection and the guidance provided. Disinfection and work and the infection evaluation were quite vital to control of the infectious disease. So we focused on patient home and the living area, fever clinic, isolation wards in hospital, quarantine sites, schools, and the nursing home. This picture and this, okay, sorry. And this picture shows the interview. Next slide. And the ninth, conduct the health education. We CDC explored how engaged in many health education activities through various platforms for the publicity, including WeChat public accounts. We post 18-age related articles on TV, on radio, on newspaper, on media of subway and bus. And this picture shows us the interview I accepted and recently on April 8th. And I was sharing my opinion on the reopening of Wuhan. And the 10th, the targeting imported cases from abroad, closed ring management. We have 3 closed rings, triage investigation after landing, pick up and transfer, managed by the jurisdiction of the cases. We also have 3 defense lines: the custom quarantine, community prevention, and the fever clinic. In addition, we have 600%. And 100% checking passenger after landing, 100% checking healthcare, 100% checking temperature, 100% to do the epidemiology investigation, 100% nucleic acid testing, and 100% quarantine for 2 weeks. And the last one, the joint prevention and control. We also work together with the related departments, including police department, custom, transportation, education, and IT departments. And we all together to contain COVID-19 in Shanghai. And that's all I want to share with you. Thank you for your attention.
Thank you, Dr. Pan. And I think that was a very thorough explanation of what the Shanghai authority has been doing in trying to tackle the spread of COVID-19 in the early days. And I think we learned so many interesting things from your experience, that the policies or the action taken by the Shanghai local government range from the scientific part to the public education, to raise awareness and so that they could also participate as part of the public in containing the spread of the virus. Now, I have before I continue, for the participants, you can post question through the Q&A tab under your screen on Zoom. And those of you who are in YouTube, you can also post question in the comment column. It will be relayed to Zoom, so I can also see the question from YouTube. Now, my question is this: either Professor Chen or Dr. Pan could respond. Is this response in Shanghai typical form with any other municipalities in China? That is it because Shanghai is relatively, if I may say, more advanced than any than other regions in or cities in China? Is it typical response? As if you know whether this is a standardized approach in China that you just mentioned, the 11 steps or 11 parts of the response, or is it only in Shanghai, but maybe it varies across China? That's I think.
Okay. So just there is no drug, no medicine for the treatment of anti this virus, and it's up to now we don't have any vaccine, and so how to control and prevent this virus spread in Shanghai? So there are 3 steps for us. The first one, and we work hard to find the infection origin. This is a very important step for us. And the second step is to control all the close contact, to make them to stay at home or just to be in a hotel or other place to get their the first step we call the home quarantine. The next we call the how to say it's English congregation. And then for the public, and we all do some education, and public education to call all them to wash hands, to wear their mask. So these steps is very important. These steps are important to the public, and it's not these steps are used in all China. It's not only done in Shanghai. It's only in Shanghai.
Mm-hmm. Okay, thank you for the response. Professor Chen, would you like to add something in response? No? Okay.
I'm an average citizens of Shanghai. I follow very strictly of those guidance issued by our CDCP and ordered by Dr. Pan. So I follow that very strictly, even if now the general situation of our prevention of the epidemic is much better shape than before, but still, because as Dr. Pan mentioned that we have to prepare for the resurgency of the new round. So the possibility of those virus of the emergency are still there. Mm-hmm. So therefore, we have to take a kind of a precautions before we can totally, relax and be back to its normalcy. So you see that we still have our protective mask with us every day, and as long as we are going to enter into what we call a very crowded a hall or room, I mean we have to wear of those protective masks. And before, but I think that this is kind of a tradition for all those Eastern Asians peoples, that we would be very much would be willing and committed to follow what those doctors or professional staffs advise and guidance. I think that's very important. Even if I think that will continue for a couple of days, I think that as long as we have paid a lot, we have already paid high cost. So we don't want to have any kind of over or earlier relaxation to damage the results.
Right. Now, I think that's exactly the question that is coming from one of our participants, from Lily The question is, in the case of the next round, second round probably of infection, you've mentioned all these 11 steps that have been taken in Shanghai. Now, is it still in place, like the 100%, 100% checks in the airports, or other measures that you've been doing? Is it still there, regardless of the fact that probably the number of cases have been going down, and it seems that you are now all in workplace? I'm from home. So how do you prepare for the possible second round of infections in Shanghai?
So, just the next slide of my presentation, you can find that we work with the other departments. It's very important that we work together, such as if we want to control to all the patients or the suspected. So the first step, we have to try our best to detect them, to make sure who is the confirmed case, who is the suspected case, who is the close contact. So we are just do the classify to ID and to make them just in Shanghai, we set up a lot of the hotel. We just use the hotel to do just like the home quarantine, to send those close contact to the hotel and to do their medical observation. And who is the one will be sent to them, sent to the hotel, and the laboratory department of the laboratory. They will tell us, they will do a lot of the testing, and then if they go there, and all the other departments will give us the support, and they will to do the routine work each day. They will to do the medical observation, to take them their temperature, or to observe whether you have a cough or other symptoms. And also, this is very important for us. And then, is it the annual question or the first question? Is the first question?
Yeah, I think you almost answered this question that we prepare for the new round of infection. 他的意思就是，如果这个是不是我们这个流向，就是你讲的这个全检啊，会不会随着这个情况的变化，会这个逐步的，比方说放松啊，或什么时候，你可以再展开一下，判断一下现在的。
So it's hard for me to tell you the next step we will take. Now, because why we do the other 600%, because just because at the beginning of the outbreak on March 1st and March 3, and the first imported case they came in, and then we found that it's hard to control all the outbreak from imported from abroad, and half of them will stay at home to do we call the home quarantine. Maybe half of them will go to the hotel, we call the congregation. And why? Because a lot of the passengers from abroad, the capability of our hotel is not enough. For example, and at the beginning of March, I remember the Britain, I remember Japan, Japan, Korea, the passenger from Japan, Korea, and maybe Iran, maybe Italy. The passenger from 4 countries will send to their hotel, and the other passenger can stay at home to do the home quarantine. And then you will find the number of the cases increased fastly. So we changed our policy and then to call for a lot of the hotel to hold them. And at the end of the March, and we changed our policy because we want to control all the passengers. So we send all the passengers to the hotel to do their quarantine. So it's a process of our policy making. And I think maybe for the future and during the reopening of the national flights, the flights, I think maybe the passenger will come more and more. So maybe we can change our policy. But now we just do this policy and the 600%, and until we cannot to hold all the passengers.
Thank you, Dr. Pan. And there's this one question from Zoom, Aji Shakti. How big data and information technologies are used in China to deal with COVID-19? Maybe this is for Dr. Pan as well for Professor Chen. If you can enlighten us of how you are really doing this, how you manage the big data and how you process it.
Oh, it's hard for me because just I'm not the IT engineers. So we just at the end of the last slide of my presentation, I just mentioned that we work with the other departments to get the support from them, from the big data, the department of big data, and they are IT guys. So I don't know how to find the infection origin and the close contact. But I know because I know they can tell us which one is the close contact, who is the origin, infection origin, and then maybe a lot of IT technology, but they can get a lot of the support.
Right.
Sorry.
Yeah, Professor Chen, you'd like to add something on that front?
Yeah, I think in the past few years, the municipality has invested a lot in building up the so-called smart city, which integrated a lot of new technology, including the big data and cloud computing, etc. So that it will make it more easier, relatively convenient for the municipality as well as for the CDCP to identify those most important areas or infection community, etc. So I think that that kind of so-called smart city have facilitated the speed of the local government's response to any kind of a reported confirmed case or suspected case. So this plays a very important role. Even if I could not say for certain there will be a 100% of no loopholes of those data gatherings, but I think that it helped greatly, and that also make the average people, citizens in Shanghai here, much comfortable that we check of our APP of those health every day, and we can we will try to trace those different numbers, the tracing trajectory, tracing routes of all those infected people. So we understand that which area is safer, which area will be much less safer for average people. So I think that all those kinds of comfortability all depends upon those technology.
Okay, thank you for the response. And
Dr. Pan is also going to showcase some of those APP that the Shanghai municipality has applied or has asked every people to download, and we can use that for our daily checking.
So, just if somebody wants to see a doctor, now you have to stop at the gate of the hospital, and then some worker will check we call the health QR code. And if its color is green, that means you are okay. Safe. You are safe. You are safe. And then it's red means okay. I just show you. Okay, I can show you. Sorry.
Actually, everyone have its app.
We just use okay. I can show you. This is the QR. This is the QR. Okay, this is the QR code of health. It's green. This is my college's QR code. That means she is safe. Yeah. So area has one. If you use a smart cell phone, and you can download the app Alipay. And Alipay will help us. And Alipay just it's a platform. Yes. And in everywhere in China, you can use the Alipay. You can show your QR code of health. Yeah. And then if red, you have, and some people will tell you have to go to the hospital to see a doctor. Right. Yeah. So, and this is one of the IT supported from the IT department, and there are some other supported from there, such as just I mentioned, to help you because you use the cell phone to help you to find the close contact, and maybe just if I just want to find all the contacts, it's a big challenge for me and for my growth. And so get the support from them. They will maybe make me easier to find them, and then to call them to stay at home or in the hotel to get their medical observation for 2 weeks. So that the IT support is very important for the antivirus.
Okay, so I understand that now that technology in the cell phone is very important. And the QR code contains your health level or your kind of a medical record, so authorities can check you right away, or how does it use, or you can use it anywhere?
As Dr. Pan mentioned that this QR code for health has been almost universally required in our country, particularly in Shanghai, to download this app. And every time, if you are going to pay a visit to hospital, for instance, to pay a different, the different institutes or different institution, hospital, schools, and the guard of entrance will always ask you to show whether you have a green color or you have a red color. The red color means either you have your problem, you are a suspected one, or you have been to a epicenter or some infectious area, so that you will be a possible suspected one. That will cause us, kind of alert. You will be denied to access to those institute, hospitals, or you will be treated differently. So that's the big difference.
Yeah, sometimes they will call me to do the academic origin investing to that guy.
For instance,
with the red card, the red QR code.
Yeah. For instance, this time when we asked Dr. Pan to give us lectures, and he and his colleagues, because this is their first time to visit our institutes, and at the gate of our main entrance, our bodyguard will ask them to show those, whether it's a green or red. So I think this also a kind of a non-discriminatory treatment.
I see. Okay, that's
whether I know you or not, but I will see whether you are green or red first.
I see. That's a very interesting use and a very advanced use of technology there. Now, if I may continue, there's a question from YouTube. Maybe this is to Dr. Chen. Countries across the globe, including Indonesia, the United States, and some in Europe, now are talking about the reopening of the economy while they are still dealing with the COVID-19. So in China, how do you, and probably in Shanghai, how do you balance this health concern and the fact that people need to go out and carry out economic activities? So how did you do that in China, in Shanghai probably?
Yeah, I think probably Dr. Pan will also, give us his response or answer, because as a municipal government officials, our scholars, think tank people, and the doctors, it's a kind of a competition. The doctors, they always stress the importance of prevention control and give us the warning from their professional expertise perspective. And our scholars, of course, we will also have our understanding, including both those internal, domestic, and international situation, pandemic development, economic, political situation as well. And for the government officials, they have their own factors in taking into account. So this is kind of a multi-players kind of a game of competition of deciding what kind of policy finally should be adopted to deal with what you said, a opening economy as much as possible to deal with that. I think it's a kind of a dilemma, but we, as you said, I fully agree with you, we need to strike a good balance. There's no a one-size-fits-all approach. In China, the central government from Beijing made it quite clearly that as long as the peak of those epidemic has been over, different areas, provinces, municipalities, differ in terms of their seriousness of those epidemic. So that all depends upon the municipality to take a holistic view that what kind of a situations now you are in and how to respond in this kind of a context. So I think that even within China, different areas have different levels. We have at least 3 or 4 levels of rankings of those of situation for those high risk, medium higher, middle, low risk. And I think nowadays Shanghai is in the low risk, right? A little low risk, even if we face a very increasing pressure of imported case because of Shanghai is the hub. But I think that in general speaking, China, most of the part of China are in its growingly in its lower risk of this infectious disease. And I think that to reopening its economy to its normalcy as quick as possible is a must. But at the same time, the challenge for us is not that about China's situation alone, but rather how the rest of the world, including many other countries, deal with the situations. I think yesterday I talked with some of those entrepreneurs in Shanghai, and they say that even if they could have all their workers back to the assembly line, but the challenge is that the supply chain has been disrupted. They could not import those important parts to assemble a finished products as they used to. So even if in China or Shanghai, the situation much stable, quite a number of those factories, firms, which are still have a close connectivity or dependence upon import-export, they face a huge challenge. So that's the huge challenge nowadays we face.
Thank you, Professor Chen. Dr. Pan, would you like to add, how do you see this balancing of health concern and the economy? I you are in favor of health first instead of the economy.
It's a balance. So for us, we want the people stay at home, don't go to work. So for everyone just in Shanghai, they want to make money. they want to get back, get to the job back. So just the next Monday. Okay, next Monday we all the students in the grade
above the grade 3.
Sorry.
The senior student of those high middle school and the middle school.
We are just back to the school, and so it's a signal, and we will open. Yeah, we will open, and then the next, and I think maybe since the last month, and the governments, the Shanghai municipal government, they call for the factories or the other organization to reopen. And then even that time, it's hard, very hard, because the people, they dare to go to Shanghai, to go to other place to contact the stranger. Yeah, because they just think, because they get a lot of their education knowledge from us. Stay at home. Don't shake hands with other people, and they just physical just social distance. So it's a balance, and so for us, and we have to say, and we always to say, even I am the doctor of the public health. We just think now. I think it's now. The time is now to encourage the older people to go back to normalcy. But you have to keep the balance. If you want to go to a very crowded the place, and maybe are just a shopping mall, if you are the elder people and with the maybe high pressure, and you have to wear a mask. And also we talk our people after you go back to school, after you go back there, maybe the factory, and you have to wash your hands after you go back to home, or go and get off from the subway or the bus. You have to wash your hands. You don't touch your ear, the nose, or the mouth. And this is very important. I think if you do the things I told you, and then I told my colleagues and my friends, if you do, that's just I ask you to do, and then I think you are safe. The city is safe, and this is a balance.
So don't be panic. Yeah, don't be panic.
Yes, it's a balance.
Muted.
Yes, thank you. That's very interesting. We've been talking about big data, and in the end, we're talking about washing your hands. So the most advanced thing that we need to be doing, as well as the oldest practice of maintaining health, that is essentially just wash your hand, and that will decrease the chance of us contracting the virus. Now, there's this one question I think is very important to know for us in Indonesia from our YouTube, from Ansori. How does the local government ensure people's social welfare during lockdown? Do you know how people get access to food, or because they are not working, they are not earning monies, and so on? How the local government help people with their economy, especially food supplies and so on?
Well, I think that ever since the outbreak of the epidemic, and the central government as well as the municipality have anticipated a increasingly severe economic upheavals and cost to the whole society. We know that those most vulnerable peoples are those who have no regular or permanent job. They have to, prepare for what we call a hand-to-mouth daily lives every day. So these are the most vulnerable part of the peoples who, when they exposed to the pandemic upheaval, will cause a serious problem. The local government has issued a lot of subsidy and a relief policy to them. And for instance, the local government has tried to persuade those, give a lot of fiscal and tax relief to those self-employed people. And also with those small and medium-sized companies, local government will also give a lot of debt or delayed payment of those tax as well as other fees, so that those small and medium-sized companies could survive and without laying out those employees. But even I think that Shanghai nowadays, the situation is still, economic situation, generally speaking, is still in a relatively good shape. But we have to prepare for a worst case scenario when those ongoing pandemics still there, and more economic fallouts will be on the whole societies. I know that government has prepared for a more fiscal monetary policy relief to those companies, and also prepare for some direct what we call a coupon for those which is most desperately needed. For instance, it's not adopted in Shanghai, but it has been adopted in the epicenter, used to be the epicenter of Wuhan and Hubei. And I know that our neighboring city, Nanjing city, the capital city of Jiangsu province, they also adopted those coupon distribution directly to the citizens. So it will encourage them to do shopping. The more vulnerable people, I mean the more poor people, the much more coupons they will get. So I think in that at least will give some relief. But anyway, I think that this kind of a crisis will deal with direct and quite long-term blow to every aspects of the society. And both the government and the non-government organizations, entrepreneurs, the charity organizations, we all need to work together to support those most vulnerable people and to keep the whole society stable.
Thank you. Thank you, Dr. Chen. Now, this question for Dr. Pan. This is from me. You mentioned about the use of TCM, traditional Chinese medicine. Would you, in tackling and taking care of those who are COVID-19 patient, would you elaborate more on that, the use of TCM, traditional Chinese medicine in this, because this is going very interesting for us to hear.
Yeah,
generic 就是你说大致的讲一下，他就是可能
So okay, so it's challenging for me to give you some correct answer, and just the Chinese traditional Chinese medicine is used by the Chinese people, and then for me sometimes when I feel my stomach and body, and my mother or my grandmother will take me to we call it the Hospital of Chinese Traditional Medicine, and it's but just the elder people think it's a very important method to treat the disease, but for the young guy maybe it's very hard to for them to believe in Chinese traditional. But in reality, for the the coronavirus, and according to the knowledge, according to the paper from our colleagues, and compare with the medicine, maybe just some kind of the medicine to cure the malaria. It's introduced by some other countries present in other countries. But in China, most of the doctor has introduced the Chinese medicine even in Wuhan and or our city in Hubei province. And in China, in Shanghai, we also use the traditional Chinese medicine to treat the patients. It's useful, and because we, this in China, in Shanghai, and we have. It's almost the 700 patients in Shanghai in total, but only 7 died. Besides, we use a lot of the methods to treat them, but the traditional Chinese medicine play a very important role to treat them. So it's a good news for the patient infected by the coronavirus. So in the other, just a lot of the doctor were sent to the other city, including the Western countries, and all of them to introduce the Chinese traditional medicine, traditional Chinese medicine to those countries to use the Chinese. Use the Chinese medicine to treat their patient is useful for us, I believe.
I would add a point from not a professional doctor's perspective, but as a average people who sometimes, on some occasions, suffer from those diseases. Maybe I'm a little old, so I would prefer those traditional Chinese medicine rather than what we call a Western medicine. I'm not quite sure how representative I am, but as long as got a fever or flu, and or something wrong with my stomach, I would prefer those traditional medicine, because the philosophy of traditional medicine of China is quite different from those Western medicine. And traditional medicine would treat the human body as a whole, and usually treat the body from a holistic perspective. So those traditional medicine, on one hand, they are much more capable of playing the role of prevention. And then they can also, to some extent, alleviate some of the symptoms. But of course, if there are some very acute illness, and usually maybe it's too late for traditional Chinese medicines to control them in an immediate and quick time, then we will rely upon. But having said that, I mean that we have heard a lot of reports and from the past few months that during the fighting against this new identified virus, both those Chinese traditional medicine experts, as well as those doctors who are more knowledgeable about those Western medical training, they work together. As I said, that because this is newly identified, and we will try everything we can. And we also keep all those possible ways open. And I think that those mixture of integration of these two sides actually have maximized the effects of treatment rather than minimize the effect. So this is what I understand. So I think that, as Dr. Pan said, following or during the battle against this pandemic, the Chinese traditional medicine, as well as those experts, doctors, they find new opportunities to to have those Chinese traditional medicines in treating the patients, as well as to find some ways to at least to deal with those virus.
All right, thank you. Now there's a kind of a follow-up question on that from one participant on our YouTube channel. What about the progress of vaccine development for COVID-19 in China? How do you see this vaccine development? Is there any task force to find the cure, the vaccines, or collaborative research with other countries or other institutions within China, outside China? Would you update us on that from the Chinese side on the vaccine development for COVID-19?
Okay, just in China, the vaccine research is a very important thing to anti this infectious disease, and there are several research groups doing this kind of work. And one of them is from the national CDC and the director of the Chinese CDC. I mean, just national CDC in Peking. And this group, and according to the newspaper, I know just they made some progress and to this area. And another group I know maybe from another scientific institution and a very important researcher in this area, and I mean just in vaccine area, they have already made their vaccine, and then the next step will do the trial, and also in the neighboring province, the Zhejiang province, there is a very famous doctor, Dr. Li, and her group, according to my colleagues and working in the Zhejiang province, the provincial CDC, and she told me, and they have maybe it's close to the achievement, and so this is a progress of the research in China. I think, and even we have already made so progress, maybe so success the research result, and just there is a very long time to make all the people to get free shot. It's a long time. I think maybe at least half a year. At least half a year. It's not enough. Maybe 1 year, maybe 2 years. We have to make it. We make all the vaccine of coronavirus is safe. To make all just a lot of people. I know just some people maybe in the other countries, maybe Western countries, they don't believe in the vaccine, and maybe they think it's dangerous for the body, and so some of them worried about the side effects. So they just anti the vaccine. So, and in China, we all of us, the researchers and the doctors, or the people in our society, they worry about it. Is it safe? So the groups, the research groups, they want. It's not first choice for them just to produce, just make it safe, make safe, and then the first step safe, and the second step just to make you to prevent the virus infection. So, but the good news, I hope, I know just at least 2 or 3 groups, they have already made progress. Yeah, and I think maybe maybe the 6 months, maybe 1 year later, and then I think they're good. And I think they're safe, and then they're effective vaccine we will get the shot and in the hospital. And I hope, and it will be helpful for the world. Yeah.
Right. Thank you, Dr. Pan. Now there's a question on I think this is for Professor Chen from YouTube, from Pero. She is our head of China Study Center at CSIS. Would you enlighten us on how does this pandemic impact the economy of China in general?
Well, frankly speaking, the negative impact of this epidemic on China's economy is much consequential, dire than we expected earlier. Largely because we do not expect there's a quick spreading and resurging in the rest of the world. Because our previous model of the prediction of the impact on China's economy is largely dependent upon to what extent of how and when the China can successfully in controlling of the disease at home. And our prediction is that the first quarter will be largely used to prevent that. Then the second and third and the fourth will be much better for China to revive. But that kind of a model of prediction does not take into effect of the rest of the world. So when the rest of the world, when the disease spreading very quickly beyond our expectation, outside of China actually, and make the Chinese, many of the multinational companies, joint ventures, as well as many local companies who rely upon those imports, exports, they have to suspend their operation. So those double shock, double blow, both from those outbreak control and prevention at home, as well as a much longer duration of control prevention outside, it's a double blow to China's whole economy. So this is the reason we have seen that the first quarter, for the first quarter, the total the GDP has the loss. We have seen the economic loss about contracted 6.8%, the biggest loss in the past decades. But having said that, I think that we will never underestimate the resilience of China's domestic market itself. And I believe that at least a couple of positive signs have been already there. Number one, as for China as a whole, the epidemic control situation is much better than most of the world. And I think that, as Dr. Peng has mentioned, these important economic hubs, including Shanghai, have accelerated their pace of returning to its normalcy in terms of economic activities. And China as a whole has one of the most comprehensive industry production chains. Therefore, even with those disruptions of our disruption of the outside, the China could continue to do a lot of, or to resume a lot of its economic operations. And secondly, in the past few months, those IT-related technology has been more widely used and upgraded. They have been boosted, I think, in a drastic speed in terms of those online education, online office operation, online chatting, as well as the webinars we now use. So if you check those profit gaining report of those giant IT company, I'm quite sure that Alibaba or Tencent or some others, they will gain rather than, lose
Yes.
in terms of those total quota of their business. I'm quite sure I have not seen their statistics, and the government have already, asked the whole or all of those companies, whether they are a private ones or they are a state-run, to grasp this opportunity to invest more into this, what we call a new infrastructure, particularly refers to those information or IT related technology infrastructure, as well as what I said, that to accelerate the pace of a smart city, smart provincialities building up. So I think that those investments will be accelerated. And so in all, the economic impact on China as a whole is a little bit bigger than we previously predict. But those resilience of Chinese market, as well as the huge investment in those infrastructure. Don't forget, China as a whole is the world's second largest consumption market. And the biggest, for a country per se, the biggest middle class population. So I think that this biggest consumption market will have a huge impact on how its economy can revive in the years ahead. But of course, we all expect that the rest of the world, including Southeast Asia and Europe, United States, they could handle their controlled prevention as efficient and quickly, so that we all can back to our normal economic activity.
All right, thank you, Professor Chen. Now we are going back to the question on the health, aspects. In your presentation, Dr. Pan, you mentioned about the demographic in Shanghai. 32% of the populations are above, I think, 60 years old. So how is there any specific policy or measures that you implement on these elderly group of people in Shanghai, because they are, with the experience of other areas, they are the ones who are probably most vulnerable for contracting the virus?
Okay, we compare with the other city, the Shanghai, we call Shanghai the old city. That means just the percentage of the elder people is more than the 30%. So, and it's a challenge for government for them to prevent being infected. And there are some steps carried out by the government. The first step, there are two parts. There are two parts amid their elder people. One of them, and they lived with their son or with their daughter, or just the grandson or granddaughter. And some of them just live in, we call them their nursing home. Just so for we call it big family. Just in China, and the people like to stay together. We call it big family, and so enjoy the pressure and with from the mother to son and the grandmother to grandson, and so the Chinese people likes to live together. So this is the challenge for us. Just the elder people have a high risk to be infected and by the coronavirus. So and during the education, we just to mention the young guy. If you just don't do wash hands, don't do just wear the mask, you have a risk to bring the virus from the outside into your home. It's a very important step. You, the young guy, you need to pay attention to when you do go to work, go to pray with your friends, and so you have to wear mask. You have to and the disinfection your shoes and wash your hands when you back to home. The first step, education is very important. The first education, health education. The second one, and just the nursing home is a very important place we have to pay attention to, and I think in the past 3 years, past four months, and there are only one cluster reported by us, but it's very fortunately no deaths in that cluster. All the elderly alive, and it gave us a signal. We have to take care of this elderly. That's the beginning of the outbreak. I mean, just those outbreaks. So from that time, I think maybe in January, maybe in the middle of January, and so we take action to just make their, I think make a protocol, and made a protocol in, I think maybe in the middle, maybe at the end of the January. I don't remember the exact date. And they should call them the first one. The nurse. In the nurse home, the worker is very important, because the elder people, they cannot move just like the young guy. They will always stay at their, most of the time they stay at their nursing home, but that's very, very dangerous for their workers. They can bring the virus to the nursing home. So we give a very detailed protocol to call them, to guide the workers to how to do their work. They get the guidance from us. I give you an example. And just like I told the story, and before I came here, we check their situation, health situation, at the gate, and then maybe some the workers stay there and to check their, you mean just the QR for health, the QR code for health, step 1. And step 2, and then to call them to wear their mask if they don't just have one. And then the third step, and then to check their temperature. The fourth, and to give just disinfection. For example, we use the alcohol. It's not alcohol, just alcohol. Their alcohol to disinfect their hands and their shoes. And there are 4 steps to make sure those workers are safe. And besides this, just some workers, maybe they came from the neighboring province, maybe from the Jiangsu province, maybe from Zhejiang province, maybe from the Anhui province, some of them maybe from the Hubei province. Just the Wuhan is the capital of the Hubei province. So if they came from the Hubei or just the other province, maybe we call them important province. I asked maybe the boss of the nursing home to ask those workers to stay at home to get their medical observe at least 2 weeks and to make sure they are safe. Their health. So after 2 weeks later, we can permit them to back to their work. So generally, it's a lot of steps. Then I just give you some example for them. So the elder people is our, just in China, we respect elder people. We don't use the others. We just protect them because treasure. It's our treasure. Yeah. So that's all.
I would like to share a personal story because
Yes.
my father-in-law who suffered from the AZ, the Alzheimer's disease.
Yes. Okay.
Alzheimer's, and he also broke his backbone during the Spring Festival, which still during that period, those stories about those epidemics already ongoing but had not been formally announced in Shanghai. So we sent him to a nursery house for a more professional care. The following days, we sent him there. Then there's an official announcement of the, the epidemic. The nursery house is the first to be required to totally quarantine. I mean, those isolated. No visitors access any longer. So we could only have a kind of a video chatting or video, talking with our grandpa, even if he himself sometimes could not remember everything. And the nurse, the healthcare staff, as Dr. Pen mentioned, he used those smartphone video WeChat facilities to help us understand the real-time situation of my father-in-law. Until last week, then the nursery house, a strict close policy protocol has changed. So we are allowed to have a visit. Yeah. So I think the story has shown that how strict the local government has concern about all those most vulnerable peoples, particularly the senior ones, because they are the most vulnerable. The young kids, the kids and most senior ones. The kids, because they have no idea how to protect themselves. While the senior ones, because in terms of a health situation, is much more fragile than those young people. So I think that they have received special treatment.
I see. All right, thank you. We still have 3 more minutes, and I have this one urgent question to Professor Chen. This is the international aspect of this. How would you suggest we move forward with the international cooperation to better prepare for the next pandemic? On February, there was ASEAN China foreign ministers meeting on COVID-19. That's one. But do you have any thoughts on how, at least in the region, Southeast Asia and China, how do we better cooperate to better prepare ourselves?
Well, I think that as we all understand that this new identified, the virus respects no borders. And this newly identified virus is also very smart. And we people must be much smarter than it if we are going to survive and defeat them. So I think that all the governments, as well as those professionals, they need to step up the effort of knowledge and expertise sharing as frequently as possible. Because we are still, on the track of raising with the spreading of the virus. And there's still a possibility, as Dr. Pen mentioned, that a kind of a variation of this virus. So I think that we need to all work together to compare notes. This is first one. The second one is, I think that the joint effort should be stepped up to prevent of fighting against epidemic from turning into a kind of a political game. Nowadays, a politicization and a stigmatization, as General Secretary of WHO has warned again and again, has prevented international community's joint effort. So we need to work together. It's our common enemy. It's not a national war or region war. It's a global war. So I think that's a kind of a mindset is very important for all peoples. And I also believe that those think tanks people like us, as well as those professional, the doctors who have been working very hard on the front line in defeating the virus, we need to work together. Not that those politicians to try to pollute the cooperation atmosphere. And we need to have, leave those professionals, those doctors, those expertise on the front line to have a more close communication, to find out a more workable way and to joint research of those vaccines as well as other treatment medicines.
Thank you. I think on that note, on the importance of cooperations between the countries, professionals, and probably regional organizations as well, I think the way forward. And then at least for us, CSIS and Shanghai Institute of International Studies, I think we should continue this kind of cooperation. And this is much easier now because we are used now to use these video conferences instead of flying to Shanghai or flying.
No time differences, all right, no travel cost.
That's true. And then we noticed that there are two flags on your table, flags of Indonesia and flags of China. I think that's a good sign of future cooperation between Indonesia and China and between CSIS and SIIS. So thank you once again, Dr. Pan and Professor Chen. This has been very useful and very informative, and I believe it sparks a lot of new ideas for us to work within Indonesia and with China as well. And to those who are watching this, thank you very much. And then please log in again next week for our next webinar. Thank you very much. Have a good day and hope that we are all stay safe. Thank you, Professor Chen and Dr. Pan and friends in Shanghai. Bye.
Thank you.
Bye. Bye.
Bye-bye. 关掉。